Good morning, everyone. I'm very happy to see so many names connecting to this important webinar. My name is Tomáš Novotný, and I'm very happy to be the host of today's webinar. It's 10 o'clock, 10th day of the 10th month of this year. So we will take a look at endocrine disruptors and the first insights into the new guidance on endocrine disruptors. I can see very many also familiar names, so I'm very happy that we can all be here. And I would very much like this to be also a discussion, taking advantage of the expertise we have here today. So please do not hesitate to ask. If you have any questions, you use the Q&As window, or you can also ask, raise your hand and ask over your microphone. So what's ahead of us today? We have two great speakers. I hope you can see the presentation. Sorry. Yeah. Okay, good. So what's ahead of us? You never know what you're gonna get, but today, I guess, we will be exploring a lot, but what you are gonna get from us will be the recording of the webinar, you will get the presentation, and of course, our popular Q&A sheet. So any question that you ask, if we do not manage to answer it during the webinar directly, we will get back to it and we will put it into our Q&A sheet, which will be circulated after the webinar. I'm very pleased to have Adam as the toxicologist and ecotoxicologist expert who will give us the expert view on the new guidance. Welcome, Adam.
Hello.
And Ales, who will guide us through the regulatory and legal background of this new guidance and its implications. Hi, Ales.
Hello, good morning, everybody.
So let's jump right to it. We will try to leave at least 15 minutes for your questions and answers, but the topic is very broad. So if you have any further questions, get back to us. And also, we will most likely do a follow-up webinar. So I will ask at the end if you have any further topics or areas where you would like to get into more detail. So without any further delay, Adam, the floor is yours, please.
Thank you. Thank you. So I will share the screen. Okay. So welcome everyone to this presentation. It's also a lot of names, a lot of familiar names. Nice to be with you. I didn't see some of you for some time, so I'm happy that you came here. Today I will present about my favorite topic, endocrine disruptors, and within this favorite topic I will talk mostly about the new CLP guidance. About the content of the presentation, first some up-to-date information, then criteria and classification, something about guidance, mixtures, impact, requirements, and solutions at the end. So what's happening right now with the guidance on the application of CLP criteria? So there is not final version available yet, sorry about that. But we have new final CARACAL version 8 from the end of September. So this is the guidance which I am basing this presentation on. And this version reflects the comments from CARACAL. So it's a technically very, very final version. Next step, what should happen is that there would be CARACAL review, last CARACAL review on 11th October. So you can still do some comments on the comments of CARACAL. And subsequently, there will be validation by the European Commission as a political power. But I would say this version is pretty much the final version. I wouldn't expect any big changes. It's also visible from the comments of ECHA on these last changes that they just don't want to change anything. They want to use this guidance and see what will be happening in practice. Speaking about ECHA, the current expectation is that the guidance will final guidance will be published in the end of October. And there is also ECHA presentation on 21st November. So I will be going there. I think it will be interesting. There's also a link here, so you can also check this. When I was preparing the presentation, I first wanted to do more toxicology, ecotoxicological, more detailed presentation, but then during the registration, I saw a lot of comments and I realized that there will be a lot of people who are not toxicologists, ecotoxicologists. So I decided to kind of step back and tell also some beginnings. So this is the regulation which implemented the endocrine hazard classes into the CLP. And this regulation is almost 2 years in force. There was also a question about scope of the guidance. So endocrine criteria implemented into the CLP, which is kind of central regulation. And the guidance is describing part of the CLP. So consequently, all REACH biocidal product, plant protection products are directly affected. And indirectly, there are affected some surrounding legislation as medical devices, cosmetics, and so on. So if the compound is banned, then you cannot use it in the cosmetics. What endocrine hazard classes are there in CLP? So it's endocrine disruptors for human health and endocrine disruptors for the environment. And both of these categories are divided into the both of these hazard classes are divided into 2 categories. So category 1, known or presumed endocrine disruptor, or category 2, suspected endocrine disruptor. And what are the criteria for classification? So there are 3 criteria for endocrine classification. It's endocrine activity, so some change in the hormones. Then endocrine adversity, so some adverse effect on the organism. And then there needs to be a biologically plausible link between those 2. And then category 2 endocrine disruptor is when the evidence is not sufficiently convincing for the category 1. Classification is made based on total weight of evidence using expert judgment. So you need an expert to do this. And also the classification is hazard-based, so similar as carcinogens. I have to say that for me, back in this 2017-18, when the hazard base was first announced, for me it was like end of the science in the regulatory. Like I was really like heavily affected by this, and it's still continuing. So more chemicals will be classified according to this new guidance. So ECHA is directly saying in this guidance that active substances not concluded endocrine disruptor under ECHA guidance can become an endocrine disruptor category 1 under the new guidance. So the awareness of the fact that this guidance is stricter, broader, it's clear, and nobody is hiding that. All previously identified endocrine disruptors will become category 1 endocrine disruptor. So that's a current ECHA list of endocrine disruptors. Then also endocrine disruptors recognized by ECHA guidance within biocides and plant protection. So there are no doubts that if it's already decided, it will become in the broader, more strict guidance as endocrine disruptor. Then in yellow, there will be most probably some new substances identified by new CLP guidance, and then there will be probably a lot of substances endocrine disruptor category 2 as a new subgroup set of substances. In my view, the classification with this guidance is a bit lower level of confidence. So my feeling is that the goal of guidance is to identify and classify any endocrine disruptor using basically any approach. It's a very broad what you can use for classification. And somehow compared to the previous guidance, the 3 criteria for classification can be somehow merged, or other information can be used in place of evidence. Its modalities, due to the limited knowledge and ability to test other endocrine pathways, its modalities were chosen by ECHA Guidance in 2018, basically for practical reasons to be even possible to analyze these endocrine disruptors. So this is thyroid, estrogen, androgen, and also the substances interfering with hormone synthesis. And this approach was not taken by the new guidance. So in the new guidance, you can directly read that there are 50 hormones produced by classical endocrine glands. Then you have another 100 hormones produced by other tissues. And then you have examples like retinoids, fatty acids, may not fit the conventional view of hormone. So for me, the retinoids would not fit somehow. And then you can read also about the broad definition of a hormone as a substance originating in one tissue, conveyed by bloodstream to another tissue to exert physiological activity. So then I was thinking, like, what components in blood are not transported from one tissue to another to exert physiological activity? Then I was thinking about oxygen, water. So is oxygen and water hormone? Like, it would fit into this broad definition. I guess they are not, but basically the definition doesn't have any border. So anything can become hormone, I would say, from this. And how is the guidance written? So the guidance heavily relies on already published documentation. So there is ECHA ED guidance and Appendix F. And within there is also link to guidance with reviewing scientific literature. There is OECD 150. There is this GRC document and much more. So basically there are another hundreds of pages to be considered during this assessment, not only the 150 pages of the guidance. Finally, what was research for a long time in the universities and research institutes, so adverse outcome pathways in vitro, in silico, literature data. This all is now very focused in the new guidance. And basically anything helping to classify a substance is welcomed. But on the other hand, it's not too easy to use these approaches to justify no classification. So it's pretty much one way usage with some exception, of course. The use of AOPs is also, for instance, to prove the link between activity and hazard. And even the lines of evidence are used for postulation of AOP in AOP nomenclature, sorry. So it's really impacted by AOPs, this guidance. Then there was a lot of questions about mixtures in the registration. So mixtures, in the beginning, it's looking quite easy. So mixture is classified endocrine disruptor where there is 1% or 0.1%, depending on the category of substance within endocrine disruptor, then mixture is endocrine disruptor. But then it's get a bit more complicated because expert judgment is needed to disqualify the additivity principle. So when you have two substances category 2, both 0.6%, you need expert judgment to say that there is not additive principle, so it's not triggering the endocrine classification. Then it's getting even more complicated because there is Article 10 of CLP, and Article 10 of CLP is saying specific concentration limits indicating thresholds, which makes mixture hazardous. So in the guidance, you can find ways how to derive to lower percentage than this 1%. And there's a link to GRC document provided. But if you would look into a recent publication of one of the German authorities, they are writing that they provide evidence that endocrine substances have threshold levels for adversity, and that there could be sufficiently protective reference value derived. And they are also talking about the risk assessment that we should assess according to risk assessment. So this is definitely not happening in the new guidance, but I think it's well illustrating the very different views of member states. These very different views of member states was also visible in the CARACAL. So there was in the last version there is a deleted examples for non-classification and then for category 2. So even the pre-written examples, imagined examples by ECHA, which should show us exactly where is the border between non-classification, category 2, category 1, the member state didn't agree on them. So then do self-classification when the member states and the ECHA is not in agreement. Mixtures. Another questions, substances UVCB, so unknown variable composition, complex correction products, biological materials. So classification needs to be based on individual components. This is a bit tricky when you don't know the individual components or the components are changing all the time. So I would say it's not too much in line with the Green Deal, which is aims to support like biological solutions like plant extract and so on. But that's how is it in the guidance. Impact of the classification. So what's happened when your substance or mixture is endocrine disruptor? So endocrine classification leads to inclusion to SVHC list, so substances of very high concern. And it's on the similar level as carcinogens, mutagens, reprotoxins. I think it's even worse, the classification. The feeling is that endocrine disruptors is the worst thing. And the inclusion to SVHC leads to the authorization, potentially restriction. But this is still good because the future update of REACH discuss automatic restrictions and bans. So like automatically when the substance would become endocrine disruptor, it could be banned. So this is still in discussion, but it's really in discussion. There are another directives and regulations. So Water Framework Directive, endocrine disruptor is put on the Annex 10. So there's a lot of work connected to this. Then plant protection biocides, you need to watch coformulants, impurities, that it will not trigger declassification of the product according to the CLP. Then change of the classification means to update labels, SDSs, REACH dossier, CSR, PCN notification. But basically that's a piece of cake compared to the automatic restriction. Just money and time, you know. Data requirements in CLP, so very often question. So CLP does not bring data requirements. However, CLP wants you to do all data assessment, literature review, and weight of evidence expert judgment. So significant time and resources are needed to do so. You need experts, group of experts. I have recent example from Rich Chemical. So there was 200 hours of consultants spent for this assessment, and it was like average data set Rich Chemical. In the biocides protection, it's easily 300 pages documents with very extensive Excel file, where in this document you need to dismantle into tiny details all the studies, reread the studies. and it's really difficult. It takes time, and that's only with the basically 4 pathways, not included these hundreds of other hormones. You can check, it's publicly available. These documents are on the internet. There's also some diversity. So if you read the guidance, they say you can do literature search or preferred really systematic review. But a lot of my colleagues here are doing systematic reviews for ECHA, EFSA, or people in building here. And it easily takes 1 year of teamwork to do good systematic review for one compound. So there's a huge difference in this. So how to plan classification assessment? So how to deal with this evil disruptor? To comply with CLP requirements, companies need to assess their substances according to ED criteria. My recommendation would be to assess all available data according to new CLP guidance and make conclusion accordingly as soon as possible. Really, the time is running towards the end of the deadline. There is not so many people who can help. I would recommend to try first light assessment, looking in for ED indicators, search literature if there is not something, some alarms and so on, and later to do the full assessment and literature review when you feel it's needed, if you want to have it perfectly done or if you have some indicators which you need to look at from this first light assessment. I think also to save resources, companies can assess with groups of similar chemicals. So cooperate with your competitors, share the data, and do the assessment together. Regarding the mixtures, I would recommend to be sure that you have updated SDSs of constituents and that you believe the people who are sending you these SDSs that it's correctly assess for endocrine disruptors. For UVCB substances, fingers crossed for you. And remember that final decision about the harmonized classification is ECHA. But when these substances are at ECHA, there is only 2 months commenting period. And in these 2 months, you cannot do anything anymore if you are not prepared well for this stage. So REGARTIS can provide the initial screening, as I was talking about, and we can also provide basically any services regarding the endocrine disruptors based on the individual agreement. Then for the conclusions, European Union continues with a very strict approach towards endocrine active chemicals within biocidal plant protection and REACH regulation. These criteria in CLP are the strictest so far, and also the guidance is the strictest one. It's also the most protective guidance. I think it's good guidance for the goal to identify as many substances as possible as endocrine disruptors, but that's of course has some consequences also, not only in the sense of protecting people, but it's applied very similar approach as for biocides and plant protection substances, but these substances has a huge data set, so there is what to assess. But in rich chemicals, sometimes the data sets are very, very small. So thank you for your attention. The question will be after the next session, and I'm looking forward for these questions. Thank you.
Thank you very much, Adam. It was inspiring how you were able to cover so much in such a little time. Thank you for this. And I would like to invite Ales to give us his legal perspective on some of the hot topics and questions arising from this guidance.
Thank you, Tomáš. So indeed, I will build and further develop what Adam already said, because his presentation indeed was quite comprehensive. But I will give legal aspect on several questions. So my name is Ales Bartl. I'm a partner in Brussels office of a law firm, Keller and Heckman. We are specialized in chemicals regulations, but also in product regulations, and we also represent clients in the European Court and in the Board of Appeal of ECHA. And it's my pleasure to having this presentation today. So let's look first at on the timelines for applicability. So currently we are at the transition period. So for the time being, you are not subject to these obligations, but already from November 2026, all substances will have to be labeled, also classified, not only labeled, but also classified. Both obligations apply at the same time by November 2026. However, new substances must already be classified and labeled on May 2025 if they are placed on the market. And placed on the market means imported or supplied. ECHA has been sending a bit mixed messages as to what new substance means, whether it's a completely new substance that has never been placed on the market in the EU, or whether it's a new batch of an existing substance. In our view, the only answer is it's a new batch of a substance. So that means that in order to benefit of the transition period until November 2026, substance specific batch must already be either imported or supplied before May 2025. Manufacturing is not enough. If manufacturing without supply is not placing on the market, import is. Yeah. So, and the idea obviously is that if an existing batch is placed on the market for the first time before May, it should reach the end user by November 2026. Because if again this new substance is further supplied either after November 2026, it needs to be labeled and classified anyway. And obviously, the same rules apply for mixtures, only 1 year later. The idea being that it's more complex to classify mixtures than substances. So then let's look at the legal obligation to classify and label substances and mixtures. Just a few notes. First, it should be borne in mind that this obligation is not only for manufacturers or importers, but also for downstream users such as formulators, who further supply chemicals or mixtures. So of course, downstream users very often rely on the classification in the safety data sheet received upstream, but this does not exempt them from the obligation to assess whether actually the classification is correct. They also have an obligation and they can be subject to enforcement. As Adam said, obligation to identify relevant available information. Adam provided, I think, quite comprehensive guidance on this. But I would like to point out a provision in CLP that says that when evaluating the available information, operators should consider the forms or physical state in which the substance is placed on the market and in which it can be reasonably be expected to be used. So this provides some, let's say, flexibility or some leeway to maybe relax the classification. The bioavailability factor can be taken into account, that actually the substance within or the hazardous substance within another substance or a mixture is not bioavailable. Also, particle size criterion. If the hazard is related to particle size, one can argue that if a substance is embedded or in different particle sizes, then actually it's not hazardous. And of course, the classification labeling by REACH registrants is the most prominent. It's actually where everybody looks first. So I think REACH registrants, there's some burden on them really to be the driver for the classification. What are the enforcement and liability consequences? Well, first, ECHA compliance check. Classification and labeling is a data requirement in the REACH dossier. So in principle, ECHA can also check if the classification in a REACH dossier is accurate. But I'm not aware in practice of many cases like this. I think, yeah, the compliance check usually does not relate to this data requirement. The same, in my experience, is for enforcement authorities. Enforcement authorities quite rarely, in my view, enforce the classification and labeling mainly obligation, saying, kind of reassessing whether the classification and labeling is correct and enforcing it towards the operators. I think that really the main tool, if the authorities disagree with the classification, is that the authorities submit a proposal for a harmonized classification and labeling, imposing their view on the hazard. Yeah, so for enforcement, really, I don't think that there is a lot of cases of direct enforcement. But liability consequences, of course, are more prominent because if there is an incorrect classification, there can be potential liability claims by downstream users or consumers under national laws. Good thing is that, in my view, under most national laws, in order to be successful, a claimant must suffer an objective damage. His health or environment, obviously, must have been objectively damaged, which, for example, in case of endocrine disruptors, may not be that straightforward. And obviously, there are contractual liabilities in the supply chain. So you should check your contract with your suppliers and with your customers, whether it accurately protects you in terms of classification and labeling. What to do if there is a disagreement in the supply chain? The CLP and CLP guidance specifically allows the use of external experts to do the assessment. And this actually may be necessary to overcome disagreements in the supply chain. It may be possible that manufacturer, formulator, distributor have different views and also suffer different downstream consequences of a classification. Manufacturer might not care about the classification. They just put sticker on the package. But for distributor or end user, this actually may have very serious consequences. And of course, there may be disagreements between REACH registrants. So in our experience, and we have done it already several times, it may be worthwhile to establish a panel of independent toxicologists who really come with a clear conclusion how the classification of the substance or a mixture should be. But for this, it's important to have good contractual basis, to have really some kind of task force agreement that will establish, the way how the task force will cooperate, how they will exchange the data, how they will communicate with the experts, and most importantly, there must be a clear obligation by the companies that participate in the task force to actually apply the classification as concluded by the independent panel, and it's tricky how to formulate it. Another important aspect is ECHA classification and labeling inventory. There is the upcoming CLP amendment in the pipeline, as you probably know, and it provides some important changes with respect to classification labeling inventory. First, it sets a deadline for notifiers to notify. It provides that the notifiers will be, the name of notifiers will be publicly available. And there is an obligation to provide reasons in case of divergence from existing entries. As you know, when you look currently at the classification labeling inventory, you see really a lot of divergences in classifications as notified. So the ECHA or the EU would like to handle this, tackle this. So at least pushing companies to provide reasons. Another important element is, as you probably know, there is ECHA InfoCard functionality that provides all information, all regulatory information, the ongoing existing scrutiny of every substance on the EU market. And there are flags. It's something that appears directly next to the name of the substance. And ECHA seems to use these flags, such as this substance is a CMR, this substance is under evaluation for ED or PBT. ECHA seems to use these flags even if the substance is classified by only a minority of notifiers in the classification labeling inventory. So there is a risk that if only just a minority of operators classify substance as an endocrine disruptor and notify this classification in the inventory, ECHA will already use this flag. This substance has been classified as an endocrine disruptor, full stop. I think this may have important downstream consequences. And of course, if there are divergent classifications in the inventory, it will raise two questions from customers and bigger chance of initiation of harmonized classification and labeling procedure. There are some new tools to facilitate harmonized classification labeling. Under the one substance and one assessment package, there will be a possibility for the Commission to mandate ECHA or EFSA to prepare a classification proposal. Currently, the classification proposal is only for the member states or for operators. This will probably increase hazard classification procedures. Under the OSOA package, there is also possibility for ECHA to commission studies on substances and mixtures itself or at the request of the Commission. So there is a risk, hypothetically, that ECHA will commission an endocrine disruptor study for a substance that is on ECHA's radar, and will just trigger the scrutiny based on this study. And the question is, and this is not handled under the package, what are the remedies by the operators, by the manufacturers and importers? Are they able to challenge the study and its outcome and its design? This is not clear. And as Adam said, there will be automatic harmonized classification for endocrine disruptors identified under SVHC or under BPR or PPPR. This will be done by the Commission by a delegated act. So it's actually not that automatic because the Commission needs to first issue delegated act. The delegated act will be discussed inevitably at CARACAL or maybe even at REACH committee that also deals with CLP issues. So there may be, I think, some possibility in some cases to avoid that by lobbying maybe with the Commission. Just a thought. Again, one substance, one assessment. The likely outcome of this principle, once established, is that the CLP regulation would become a centerpiece for hazard classification, and centralized hazard assessment and limit value setting would be performed by ECHA. So really, limit value setting would be performed by ECHA, and this limit value setting would be in a way binding for future risk assessment, which means as a risk that hazard may actually prevail over risk. Because, for example, with respect to endocrine disruptors, REACH provides specifically that no safe threshold can be established with endocrine disruptors, which is a bit the same like PBTs and VPVBs. So it's actually, there is a risk that ED classification would become an automatic showstopper in a risk assessment for specific applications, such as in food packaging, in cosmetics, in toys, etc. Another important element is that, as you know, there is a pending revision of REACH, pending for a very long time, long overdue. But at one point, the Commission will prepare a proposal to revise REACH. And although some of the elements may be off the table, as announced previously, I think that new data requirements for endocrine disruption endpoint will be there. So REACH will include, likely, a new REACH registration data requirement for ED endpoint. That means that the companies will be actually obliged to submit and potentially also generate new data. And I think the idea behind that the EU has is that first, they want to push industry to generate data under REACH, then subject specific focus substances to harmonized classification and labeling procedure, leading to a generic restriction. I think this is really the pathway for the EU to ban endocrine disruptors on the market. So now I will obviously talk about endocrine disruption as a candidate for generic restrictions. Adam already mentioned it, so I'm just put some notes. First, only substances with harmonized classification and labeling as endocrine disruptors would potentially become candidates for generic restrictions. So harmonized, not just self-classification. Also, the question is whether only category 1 or also category 2 endocrine disruptors will be subject to generic restrictions. I think that I didn't see any clear word from the EU, but I think there are good arguments that it should only be category 1 in the same way as CMRs. The generic restriction will not only apply to consumer uses, but potentially also to professional uses. The big question mark is whether it will only apply to substances or mixtures or also to articles. And I think the EU has to work a bit on this. And the generic restrictions will apply unless the use is essential. And just one quick note, recently the EU published a new essential uses guidance, and good for industry. In my view, it contains somewhat broad definition of essential uses, not only necessary for health and safety, but also, for technological sectors, for example, for essential technological sectors in the EU. Few final remarks. There may be also some opportunities here. First, the EU is pushing its regulations through JHS and UN level to give competitive advantage to EU industry. And based off what I've seen, the endocrine disruption classification under JHS, it's really a EU priority. So EU is as a priority pushing a new classification as endocrine disruptors under JHS, in which case, obviously, this would become globally applicable and may give some competitive advantage to EU industry who would be prepared first. We should also take into consideration the industry deal. As you know, industry deal is let's say a counterweight of Green Deal that the Commission is currently considering because the EU is realizing that the regulations so far give very competitive disadvantage to EU industries, so they want to do something with it. And there may be some direct financial incentive to help industry to transition to, let's say, safer chemicals, for example, but also to help them a bit with energy prices. As I said, there is future market for alternatives. And of course, there are obligations related to sustainability reporting and sustainability due diligence. Again, phasing out, for example, endocrine disruptors from your portfolio would look good in your sustainability profile. But for this, monitoring at the early stage is necessary, and it's important to be prepared before competitors are. This brings me to my last slide, and I thank you for your attention, and I'm looking forward to our discussion.
I'm very happy that we left 15 minutes for questions. And before we go there, I have a question for you. So we will run a quick poll on the screen. If you can please let us know where you would like to hear more. Because we covered just the basics, just the rough surface, and we will definitely be holding a follow-up webinar on this. So please help us out to tailor the webinar as much as possible. And I will shortly open the Q&A section. I will just remind you that please keep posting your Q&As. If we are not able to cover them directly in this webinar, we will get back to them and we will circulate the answers within the Q&A sheet. So how does the poll look like? Can we look at the results? 50-50. Okay, so some of you would like to hear more about the basics of endocrine disruption, and some of you would like to go deeper, so we will think about that and try to process that. So thanks a lot. I will share the screen again just to outline some of the questions also on your screens. Okay, first I would like to check if there is anybody who would like to ask live, because I saw some hands raised. Petra, Dominik, Marek, do you have any question that you would like to ask live? Please turn on your microphone if you do. If not, let's get to the written questions, and of course you can raise your hand again. So some of the questions were related to the testing requirements. I believe that was covered. So just please, the testing requirements under the CLP, there are no additional testing requirements, but there may come additional testing requirements with REACH revision, right?
Yep.
Yes.
So that's correct. Currently there's this only the assessment, which is huge basically, and the requirements should be from the REACH, and in bioscience brand protection you already have all the requirements which are primarily used for the cutoff criteria, but then the data are already there also for CLP.
Yes, yes. Okay. And the basis for the testing is OECD 150, right? The guideline, which is quite broad. I mean, for the assessment.
Yes, but for the assessment, you need to use everything, all the data. So you basically need to search for the data, possibly by data. I don't know if there will be exemption if you don't own the data, that you don't need to use that. I think you need to use all the data, and you need to do the literature search to find everything. So no.
Okay.
I'm just thinking aloud here. So would it maybe under some occasions be warranted to commission maybe some in vitro screening, studies, if there is uncertainty, or to confirm, the literature data? Is there an easy way to do that, or it's really just my legal view that actually it's not practicable?
Well, so the CLP does not require the data. So
yes, but if the manufacturer or importer actually wants to maybe confirm the findings or avoid the findings.
Yeah, but as soon as you have some data, it's difficult to disprove them. So if somebody does some in vitro tests which shown positive, you can do in vitro tests which is negative, but then it's kind of what to believe to, and then the next step would probably be to go to to in vivo testing, but as this is not the requirement of the REACH, you cannot do some in vivo testing.
Thank you. Related to that, a CRO is asking what type of studies, non-mammalian, can be expected. So, in other words, is it possible to compile some list of typical studies? I guess developmental reproductive studies will be used, but also what additional studies, or is there some particular test where you expect an upsurge in new testing?
I think with the testing now, it's not really time for testing because there is not the requirement in CLP. Of course, the in vitro tests are quite easily conducted. So if somebody has a feeling or some reasoning why to do the in vitro testing, of course, I think in vitro testing can be done. On the other hand, why to generate new data, it's probably case-by-case basis.
Okay, thank you.
There was also one question with will category 2 ED end on the Annex 3 of Regulation 1107, so plant protection, unacceptable coformulant. So regarding this, I would like to say that the category 2 is not thought about in any regulation. So it's not in the REACH, it's not in the biocide, it's not in the plant protection. So basically, it's kind of a knowledge gap. There is no legal text saying what you should do. So it's the same for REACH. Like, is category 2 going to lead to the inclusion on the SVHL list? So in REACH, it could be said that we are waiting for REACH update, but for plant protection might be more difficult how to deal with this question. Maybe one more point. During in 2017-18, the categories were already on the table for ECHA guidance, and it didn't happen. So as consequence, the legal text doesn't think about some second category. Okay.
Thank you. One very practical question, which Ales already mentioned in establishing expert panels for classification. Do you have anything to add here, Ales? How to handle different expert judgments, especially for polymers with same Cas number but different molecular weight?
Yeah, well, again, it's for everybody to make the assessment, and everybody's responsible for their own judgment. But again, as I said, if there is disagreement between experts and all experts' opinion have some kind of the same weight or are plausible, then the only way really I see there is to establish really an expert panel, and then to be obliged to follow the conclusions. And this is really this possibility is indirectly encouraged by the CLP guidance.
Thank you. I can add my own experience. You mentioned the importance of contractual robustness in this case. I recall, different conflict resolution mechanisms. Some are that, by simple majority, the expert panel votes basically, what will be the ultimate classification, of course, on the basis of evidence. But sometimes you can have different mechanisms that, for example, 70–80% of the experts in the panel have to agree. Otherwise, they need to keep collecting evidence until they do agree. So there are different conflict resolution mechanisms in my experience.
Maybe also up till the RAC, it's up to the manufacturer how they classify, so they need to protect their customers, and as soon as there is a harmonized classification, then it's clear what's the classification. Also, you can do the opt-out and do your own classification until the harmonized classification.
Yes, indeed. And another possibility how to deal with divergences is that actually one of the operators, manufacturer, importer, actually submits a proposal to ECHA for harmonized classification labeling of the substance, which gives the ultimate certainty, but of course will very likely lead to worse classification than anyone in the supply chain would actually expect. So this is really not warranted unless in a very specific circumstances.
Okay, we have many more questions, so we will get back to them in writing. But I think it already tells us that we should follow up with another webinar, maybe more focused on specific topic within the ED guidance. Last question, more like a prophetic one I have. When will endocrine disruption as a category be introduced into UN or GHS system? And the question is if it will be the next 11th revision or much later. So I would just like to have your expert opinion as visionaries. What do you think about this?
Yeah, I think it will be later, but yeah, it's in the pipeline. I think that it would have a huge impact globally. So I think the GHS is aware of this, and of course is facing not only advocacy from the EU to push it through, but advocacy from other regions not to do so. And yeah, so it's in the pipeline. It will happen at one point, but not in the next amendment.
My view is that we will see the political power on this level of European Union if it will happen or if it will not happen.
Yeah.
Because I think like US are not really in favor.
And do you have any indications about the UK?
I don't know.
Okay, so 11 o'clock, time to close our session today. But as I mentioned, thank you very much. We will definitely get back to your questions. And please stay tuned for announcement of the next webinar on endocrine disruptors or other topics. Huge thanks to Ales, huge thanks to Adam, and a great day to you all. Thank you.
Thank you.
Thank you.